Mother, diabetic in her mother and sister. Hypertension before 30 years old in her mother. Nutritional status is very irregular. She eats snack, include cake and ice cream. She has binge eating when watching TV. Anxiety status.
You are so late.
Sorry. That was it. Well, روزو اسمه ساعتون خراب کسی
بیاد اینجا دکتر بفرم خب
Anxiety status is very high, without control. She eating the food. She has bulimia nervosa. The favorite food, sweet, and chocolate and ice cream and snack, and rice and bread and fast food. History of weight reduction diet. Reduction diet 32 kilogram for 6 months. But weight gain 34 after 4 months. Exercise status, she's very sedentary, comorbid disease, hyperlipidemic, allergy with kiwi, eggs, hyoscine, and meat process. She has hypothyroid, psychiatric problem, and heartburn, history of surgery, rhinoplasty, and cyst in her hand and tonsillectomy. Drug consumption, slimming and slim lift for weight gain, weight reduction, levothyroxine, propranolol, atorvastatin, and omeprazole. For allergy, for hyperlipidemic, and for hypothyroid. For psychiatric disorder, she used citalopram. She has chest pain and dyspnea and insomnia. She has snoring in all the day. She has heartburn, nausea, diarrhea, and constipation. She has the bone pain, low back pain, and knee pain. She has very big sleep pattern of her sleep is very irregular, and quality of her sleep is very, very bad. She has hirsutism and nail problem and hair loss, and her mens is very, very irregular. Irregular.
What is her BMI?
37.
37.
She has diarrhea and constipation, both?
Yeah.
change in bowel change.
Yes.
Sometimes چه تلاشایی کرده برای کم شدن وزنش؟
تو چندین بار ولی بهترینش weight reduction 32 for 6 months, but weight gain 34 after 4 months.
Some of our colleagues, Dr. Baba Jafari, dietitian, and Dr. Mujab, you know him.
Yes.
To us, if you have any question about the patient, please ask.
About the committee, is any physician included in the committee? Physician? Internist, yes.
No. Normally, no. Sometimes we consult with them.
Yes.
For endocrinology or rheumatology, we consult with them. Or sometimes we send the patient for endoscopic evaluation. As she has reflux, carditis, and so on. she say has history of hypothyroidism? Hypothyroidism and non-psychiatric disorder. On treatment or?
Yes.
She used drug levothyroxine.
من روز دیگه روز پنجشنبه جمعه یک تونست من الان تیرویده خیلی اومده پای پرولاکتین هم افتضاح آزمایش جدیدم هم با خودم آوردم که نشون داده بعد پیش آقای دکتر راحمی تحت درمانم به خاطر مشکل گوارشی پرونده هم آوردم آقای دکتر متاسفانه سابقه زخم اصلا اشرف بعد دیگه آقای دکتر راحمی نامه دادم برای آقای دکتر امینی اصحایی میکنم شما هستید آقای دکتر امینی نه آنلاین ندارن بعد اولشون من آقای دکتر حسین خودم اومدم پیششون که مزاحمشون بشم آقای دکتر راحمی نامه دادن شخصا من آقای دکتر امینی گفتم مشکل ندارن نظر من میتونید اول انجام بدید ولی خب حالا گفتید که با سطح در نظر گرفتن شاید
کولونوسکوپی یا
بله بفرمه این کل روند هست
mild erosion in duodenums, reflux esophagitis grade A, otherwise
مطمئن میکنم آقای دکتر این اندوسکوپی هست که سکراتیه که توی این دو تا زخم از مرش نشون داده شده اینجاست این دو تا زخم
two ulcer was seen involved of duodenum. Two ulcer.
اول هنوز تحت درمانم خوب شدم مدت هستم دارو میخورم به سامبرازول
Did she consume herbals? Herbals.
داروی گیاهی چیزی می‌خورید؟
نه اصلا فقط یه مدت به هم داروی چیز دادن شیره مک میگن دو تا ناشتا به هم از اختاری بگیر بخور خوردم خیلی نمیشه
And about her GI symptoms, is it concomitant with the consumption of white reduction drugs like statin? She used drugs to reduce steroid.
برای میگه کاهش وزن اگر چیز خورده ممکنه ناراحتی گوارشش به خاطر این باشه.
اسلیم لیف و اسلیمی
این داروهای اسلیم نه همه چی میگه افتضاح هر چی میگیم این کام افتضاح این دارو افتضاح یعنی چی؟ حالا این چی یادش دارید؟
نقطه مثبتش در
شما اول باید ذهنت عوض کنید سوال اینه این در ترش کردن بعد از خوردن دارو لاغری بود یا نه؟
نه کلا از قبلش من مشکل داشتم بعد دارو
She had problem before
Regarding her psychiatric situation, now she is stable psychiatric.
خانم دکتر what is your idea?
She's anxious and she has history of anxiety, but now she has preoccupation, severe preoccupation with her obesity, and I think if her problem solved, operation will help her.
خب دیگه سوال any question?
But nobody is stable. Nobody is stable.
No.
You mean that obesity exacerbates her psychiatric problem and when improved when it's solved?
In this age?
In this case?
Yes, of course.
Because sometimes it is vice versa. The psychiatric problem lead to obesity, like in depression and others.
Yes. No.
But in this patient, the obesity induced psychiatric disturbances.
She's withdrawer, and her diet is not good. And anxiety exacerbates this problem. But her occupation and her psychiatric problem, her insomnia, I think all is about obesity and her shape.
Yes.
Does she have polycystic ovary?
No.
No,
She hasn't.
not history.
Her ultrasound.
No, she hasn't.
Her abdominal ultrasound.
سونوی شکم
Sorry.
آره سونوت نه اینا شو هیچ مشکلی
سیست تخمدان
چرا کیستایتیسی هست ولی گفت که دو
Polycystic.
She's obese and she has hirsutism.
not
داشتم
polycystic
برطرف شده
small cyst
نه دیابت ندارم
نه اون
دکتر صفا
نه
خواهد
نه
چیزی
نه
باید
نه
باید
اصلا
باید
فقط بهم یه دوره ادی داد
I think she's fit for bariatric surgery.
But LBMI is about 38, 37.
No problem. She can have sleeve surgery.
Reflux.
She have reflex esophagitis.
Reflux disease. Grade A esophagitis, not grade B. خب
What is your exercise history? تاریخچه ورزشتون برای ما
How can be associated between the anxiety? It's primary anxiety or secondary
Second is Dr. Rezai.
Her mother, diabetic, in her mother and sister. Hypertension before 30 years old in her mother. Nutritional status is very irregular. She eats snake, include cake and ice cream. She has binge eating when watching TV. Anxiety status.
دکتر بیا You are so late.
Sorry. Sorry. 12.
الان 12
بله. 12 ساعتون خراب نیست.
بیاد اینجا دکتر بفرم بفرم خب
دوباره بگم.
نه ادامه بده.
Anxiety status is very high, without control. She eating the food. She has bulimia nervosa. The favorite food, sweet, and chocolate and ice cream and snake, and rice and bread and fast food. History of weight reduction diet. Reduction diet 32 kilogram for 6 months. But weight gain 34 after 4 months. Exercise status, she's very sedentary, comorbid disease, hyperlipidemic, allergy with kiwi, eggs, hyoscine, and meat process. She has hypothyroid, psychiatric problem, and heartburn, history of surgery, rhinoplasty, and cyst in her hand and tonsillectomy. Drug consumption, slimming and slim lift for weight gain, weight reduction, levothyroxine, propranolol, atorvastatin, and omeprazole. For allergy, for hyperlipidemic, and for hypothyroid. For psychiatric disorder, she used citalopram. She has chest pain and dyspnea and insomnia. She has snoring in all the day. She has heartburn, nausea, diarrhea, and constipation. She has the bone pain, low back pain, and knee pain. She has very big sleep pattern of her sleep is very irregular, and quality of her sleep is very, very bad. She has hirsutism and nail problem and hair loss, and her mens is very, very irregular. Irregular.
What is her BMI?
37.
37.
She has diarrhea and constipation both.
Yeah.
Change in bowel habit. Change. چه تلاشایی کرده برای کم شدن وزنش؟
تو چندین بار ولی بهترینش weight reduction 32 for 6 months, but weight gain 34 after 4 months.
Some of our colleagues, Dr. Baba Jafari, dietitian, and Dr. Mujab, you know him. Yes. you have any question about the patient, please ask.
About the committee, is any physician included in the committee? Physician, internist, yes.
No, normally no. Sometimes we consult with them.
Yes.
For
And
endocrinology or rheumatologists, we consult with them. Or sometimes we send the patient for endoscopic evaluation. As she has reflux, bariatric, and so on. Has history of hypothyroidism and some psychiatric disorder. Treatment or
Yes,
She used drug levothyroxine.
من روز دیگه روز پنجشنبه جمعه یونس من الان تیروید خیلی اومده پایین پرولاکتین هم افتضاح آزمایش جدیدم هم با خودم آوردم که نشون داده بعد پیش آقای دکتر راحمی تحت درمانم به خاطر مشکل گوارشی حرامه هم آوردم متاسفانه سابقه زخم اصلا اشرف بعد دیگه آقای دکتر راحمی نامه دادم برای آقای دکتر امینی اصخایی میکنم شما هستید آقای دکتر امینی نه بعد اولشون من آقای دکتر حسینی خودم اومدم پیششون که مزاحمشون بشم آقای دکتر امینی نامه دادم شخصا من آقای دکتر امینی گفتم مشکل ندارم از نظر من میتونید اول انجام بدید ولی خب حالا توضیحی که واسهتون در نظر گرفتن شرکت
کولونوسکوپی یا
بله بفرمایید این کل روند هست
mild erosion in duodenums, reflux esophagitis grade A, otherwise
اصخایی میکنم آقای دکتر این اندوسکوپی هست که سکراتیه که توی این دو تا زخم از مرشه نشون داده شده اینجاست این دو تا زخم
two ulcer was seen involved after two ulcer.
البته هنوز تحت درمانم نمی‌شدم مدت هستم دارو می‌خورم اسپانترازول
did she consume herbals? Herbals.
داروی گیاهی می‌خورید؟
نه اصلا فقط یه مدت به هم داروی چیز دادن شیره مک میگن دو تا ناشتا به هم از اختاری بگیر خوردم خیلی نمیشه
And about her GI symptoms, is it concomitant with the consumption of white reduction drugs like statin? She used drugs to reduce her weight.
برای میگه کاهش وزن اگر چیز خورده ممکنه ناراحتی گوارشش به خاطر این باشه.
اسلیم لیف و اسلیمی.
این داروهای اسلیم نه همه چی میگه افتضاح شما بدید هر چی میگیم این کام افتضاح این دارو افتضاح یعنی چیه؟ حالا این چیزی یادش دارید
نقطه مثبتش در کتاب.
شما اول باید ذهنت عوض کنید
معلوم خودم
سوال اینه این در ترش کردن بعد از خوردن دارو لاغری بود یا نه؟
نه کلا از قبلش من مشکل داشتم بعد دارو
She had problem before
Mr. Regarding her psychiatric situation, now she is stable psychiatric.
خانم دکتر what is your idea?
She's anxious and she has history of anxiety, but now she has preoccupation, severe preoccupation with her obesity, and I think if her problem solved, operation will help her.
خب دیگه سوال any question?
But no body system. No body system.
You mean that obesity exacerbates her psychiatric problem and may improve when it's solved?
In this age,
In this case,
yes, of course.
because sometimes it is vice versa. The psychiatric problem lead to obesity, like in depression and others.
Yes. No.
But in this patient, the obesity induced psychiatric disturbances.
She's sweet lover, and her diet is not good. and anxiety exacerbate this problem. But her occupation and her psychiatric problem, her insomnia, I think all is about obesity and her shape.
Yes.
Does she have polycystic ovary?
No.
No,
She hasn't.
not history.
Her ultrasound.
No, she
Her
hasn't.
abdominal ultrasound.
سونوی شکم
Sorry.
آره سونوگرام نه اینا هیچ مشکلی نداره
سیست تخمدان
چرا کیستالیسی هست ولی گفت که دکتر
پولیسیستیک.
She's obese and she has hirsutism.
not
من داشتم
polycystic
برطرف شد
small
متفاوتی نه
cysts
دیابت
that's
ندارم
نه اون دیابت
دکتر صفا
نه
what
نه
is your
نه
idea about
اصلا
bariatric
فقط
surgery?
بهم یه دوره الدی داد
I think she's fit for bariatric surgery.
But her BMI is about 38, 37.
No problem. She can have sleeve surgery.
reflux
She have reflex esophagitis.
Reflux disease. Grade A esophagitis, not grade B. خب
What is your exercise history? تاریخچه ورزشتون برای ما
بال سرم بوده ولی متاسفانه بازم با این وجود
The patient has severe exercise 6 months ago. Aerobic dance is very severe exercise for obese patient. Not useful, but walking and other exercises, some walking in pool, bicycle is very useful for her. الان هیچ اون چیز نداره.
نه دیگه الان نه چون واقعا دکتر دیدم نتیجه نمیده فقط زانودم کمردم و
Because of
بی‌حالی
aerobic dance, he has joint pain, knee pain, back pain. The obese patient is very dangerous. Aerobic dance in gym, woman's gym.
There's a question
About her OGD, is there a head of happening or no?
no head.
Yes, sir, for evaluation of obese patient. How can differentiate between the anxiety, it's primary anxiety or secondary
Second is
obesity?
Dr. Rezai.